Well, good afternoon, everyone. My name is Dan Greer with Insurance Advisors Direct, and we are very pleased that you're joining us this afternoon for an exciting webinar on a very unique product that can really enhance your business. If you're writing in the under 65 market, whether it's individuals or group, this standalone RX plan from Pram Insurance Services can really be a great tool to have in your tool belt. Before we get started, and we do have joining us today from Pram, we have Adrian, Dave, and Diana with us today, and they'll be speaking here shortly. But before we get started, I just wanted to remind everyone, we are Insurance Advisors Direct. We are your local Michigan national FMO, and we look forward to working with you. I see many people on the webinar here today that are already working with us, and several who are not. So if you are not working with us, we'd love to be able to see if we can help you with any products, carriers, or resources that you may need to help you grow your business. So you can see my contact information there. And we would, again, any questions you may have or help you may need, we'll be following up with you right after the webinar. And I'm sure towards the end that the folks from Pram will be happy to entertain questions as well. So without further ado, I'm very pleased to go ahead and introduce to you Adrian Scotto from Pram. And Adrian, go ahead and take it away. I'll let you introduce your colleagues as we go through the webinar here today. But thank you again for helping us out.
Thank you very much, Dan. We very much appreciate the opportunity to be here today and talk about our product with you and your team. We are Pram, and today with me is my coworker Diana McClellan, and then our founder is also on the phone with us today, and his name is David Wilson. He's actually going to be walking us through the details of the presentation today. And without further ado, Dave, will you like to take it away?
Absolutely. Maybe you can go to the next page. And first, let me say that we're tickled to death to have this opportunity, especially since I get to participate. Normally, this is taken and done by my daughter, Lisa Collier, who's our CEO now. And so when I get a chance to participate, I'm always pretty excited about it. If you'll notice, it says Pram was founded in 1989. So we're not a newbie. We're a company that has been around for 30 years. And that 30 years, we've spent that time focusing exclusively on custom, carve-out, standalone, fully insured prescription drug card plans. We're the nation's leading underwriter of insured prescription drug card plans. And I think you'll enjoy taking a look at this plug-and-play product that we've designed for you here today. Adrian? There are three things that are key to our background and experience, okay? Number one, we're a managing general agent. And what does that mean from our standpoint of view? It means that we create national pharmacy benefit programs, and we underwrite guaranteed issue standalone, fully insured prescription drug card plans. So our clients are insurance companies, they're reinsurers, they're state and local government, they're national consultants. PBMs are our clients, that's pharmacy benefit managers. And we handle the entire process on behalf of the carriers that we represent. We do all the product filing, the policy issuing, the billing, every single thing that's associated with that particular program. As a pharmacy benefits administrator, we're the nation's only licensed, registered administrator that focuses exclusively on prescription drug card plans. So we don't process medical claims, COBRA, any other type of business. We simply do prescription drug card plans. We handle the implementation, the billing, the enrollment, eligibility, the claims management. We contract with the PBMs that are, if you think of us, we like to liken ourselves as sort of a manufacturer. We handle all of the specific relationships that are needed to produce a product on behalf of the insurance companies. We also handle all the financial management and reporting, and in that means we handle the bordereau. We bill the PBMs, pay the PBMs in some instances or most instances, and then we pay the remittance to the carriers. After generally commissions are paid net, so the folks in your organization probably would remit net unless they ask us to pay the individuals. We're in the consulting business. We do audit pharmacy claims routinely, and we provide advice for cost containment strategies and custom pharmacy benefit planning. Let me just say that as an auditor, we have handled accounts like Lockheed Martin, McDonald's, the state of Nevada. We built the state of Nevada's senior RX program many years ago and managed that for about 6 years before CMS came along. So we have the ability to work with you on any size account that you run up against, and you need a back room to help you get a good proposal out that you can rely on. We can handle the entire process with you, for you, or hopefully in concert with you. Adrian? We think that this product that we're going to show you today is not only exciting product for the individual market, but it's also a tremendous product for the small group and maybe some larger groups. Let me just give you an idea what I mean by that. We're bringing on a 6,000 member association of truckers. So some employers have 100 employees, some have 500, some have 1,000, and maybe there's a few with just a few lives. But it's designed with affordable monthly premiums with low deductibles that you can use and manage in any market that you come across. And we think the association market is one excellent place that this has a real fit. The product's guaranteed issue. You won't have to worry about being declined. Your members will not be declined. Coverage will be available to them simply by signing up, and that's pretty exciting. We use a national pharmacy network, which means we use 100% of the chains, 91% of the independent pharmacies, and the program's fully integrated between retail and mail service. So that's pretty exciting from that standpoint of view. We talk about enhanced commissions, commissionable revenue. There's 100% vesting of our commissions for the life of the policy. And I think that is very important to understand. There are many programs that we've run across that they might pay you one number the first year and then reduce it the second year. We simply don't do that. We have the ability to customize benefits based on experience. Now, what do I mean by the word experience? I mean electronic claims experience. So just to give you an example, recently we received a labor case, had 16,000 members in it, and had $54 million in drug spend. We were able to go through and match that particular plan on a line item basis. And it had it had 6 different plans and 6 different groups, within that program, and they all had a separate plan, and we're able to do that. So that you can feel comfortable that no matter what you run up against, we'll be there and to help you go through it. The average member uses about 1.1 scripts per member per month. And the average senior, by the way, uses 3.9 scripts per member per month. Our plan doesn't, it's 18 to 64 and a half, but if you happen to have a group that has some seniors that are over 65, their coverage would continue. We think it creates a great value and particularly sold alongside an employer's medical plan. We have people telling us if they didn't have this, they wouldn't have gotten the medical. So we're pretty proud to know that this helps in the sale of that medical plan that you're offering. Adrian, this is something that I want you to pay close attention to because this is the heart of the product. And we call it a plug-and-play product. So it has an annual deductible of $0 for generics and just $100 for the brand portion. It has two separate formularies. It has a full formulary for generic drugs, and it has the same formularies embedded in a brand, and we call it the RX Balance formulary. The copays for the generic are $10, and think of this one as we go further. It's $10 lesser of Logic, and it has a $300 monthly max. And you'll see how that monthly max is handled in just a second. The brand has the same generic copay, $10 lesser of, but we also offer brands at $50 or 50%, which means if it's $100, they pay $50. If it's $120, they pay $60. And we have $35 or 50%, whichever is greater as well. And that means if it's $70, they pay $35, or if it's $100, they pay $50. And their plan maximum is $100 a month higher. Adrian? I want to give you a little example, and this is pretty exciting for us because this is really kind of getting into the heart of it. So Dave Wilson, myself, I walk into a pharmacy, and the first thing without coverage, I'm going to be challenged to pay the retail pharmacy cost of the drug. Believe me, many drugs cost more than $100 that are generics. And if I want to walk in there and pay retail, I'm going to pay the full price, in other words, of that drug. I could say to them, well, look, I've got a discount card here. Can that save me any money? And the pharmacist says, well, let me look and see. Well, that retail drug cost is going to go down to $91. So that discount card is of little value to me. But the Pram fully insured drug card, I could say, I happen to have this drug card, and what can you do to help me here? And in this case, he's going to say $100. Well, that's only going to be $10. That's the maximum copay that you're going to pay. Keep that in mind as we go to the next slide. Adrian, what we did was one of the national firms that we work with has a discount card, and we asked them to provide us with some raw claims data. And so they gave us about 5,000 claims, and we pulled some retail drug cost from those claims that the members actually paid for these specific drugs. And as you can see, adding up, these were generic drugs. Those 7 drugs, generics, $562 out of pocket to that member. Under the Pram program, they paid $22.96, a savings of $540. That's pretty exciting. Even if they had paid a premium, and let's just say it was $50, and they paid for the cost of the drugs, $72 is a long ways away from $560. Adrian? Now let's talk just a little bit about how these plan maximums work and what you'll be up against when you're working with these in working with your individual client. The first thing is, unlike a discount card, we have a national contracted prescription drug card rate. And for generics, that rate, that performance rate, is 92% off. It's AWP minus 92%, or it's AWP minus 85%. So if we go to example 2 to start with, and the Pram cost is $8, that's all the member is going to pay. So 0 is applied to the monthly plan maximum, period. If the discount is 85% off, that member will be paying $10. And the Pram cost is $15, so only $5 is applied to the Pram monthly maximum benefit for that member. Think about that. You can buy an awful lot of prescription drugs under this particular program. Adrian, I don't know if can you make it just a little bit bigger? I don't know. Okay, I can see it. That's all right. One of the things that we want to share with you is how does this happen? Well, first is we have these discounts that are built into the program, and these discounts are what we call the performance rate of the plan. In other words, it's the lowest net cost that can possibly be paid. There is no spread. We don't take a nickel on the spread pricing of this contract. That holds true for all 77,000 pharmacies that these programs are available in. But here's a particular drug, 30-day supply. Here's 4 pharmacies that we could fill it at on the left-hand side. And here's the drug cost, right, without coverage. It's $138.90 retail. They're listed on our formulary. So yes, yes, and yes. So any one of the 3 programs. And this partner portal drug lookup makes it easy for you to help the client make a decision, whether it's a small employer or whether it's a large employer or whether it's a member sitting across the table from you. You'll notice it says type of pricing used. That's our network contracted rate, which is really our performance rate. Approximate cost for the member is not $138.90. It's $1.34. You remember the prior example that I gave you of how we save reduce those cost? Well, here it is again. I can go to any one of these 4 pharmacies. $1.34. It's $1.59. It's $4.44 at Walgreens. Look at that. That's 3 times the cost of these other 2 particular pharmacies. And look at Walmart. Who would have known that Walmart would be that expensive? Everybody touts Walmart and their pricing. But this drug had to have cost probably $11, $12, $13, maybe $15 at Walmart. And so, but the member's still only paying $10. This drug lookup portal is very exciting, and I think it'll help you make sales. Adrian, we have 2 ways to sell the product. The first way, we have it available in 32 states under the Bloom Benefits Association. And so 32 states, they can go in and market this particular product. The next slide is it's available in 45 states. You're marketing to employer plans, employer groups. That all of that's going to change. We hope to be in all states with the exception of New York and Washington, which are both very litigious states, as you guys probably already know. Adrian? So if you're marketing to employer groups, small, mid-size, large, industry examples include retail. The retail side of the business, and I can talk a little bit about that. Years ago, Deloitte and Touche came to us and said, we've only got so much money our client has. Their client was Dillard's department stores. We were able to pull that together, take that money, and got coverage for 7,000 people. It was pretty exciting. And retail covers a lot of different areas, as you can imagine. The food service industry, restaurant chains, department stores, travel industry, resorts and hotels. Very good opportunities in the resort, particularly side of the business. Transportation, I gave you an example of how we worked with an association of truckers, the grocery industry, the manufacturing, just to name a few. But any organization with a large number of clients or employees is going to be a great opportunity for you. You can pair the program with limited medical plans, GAP, MEC, optional ACA required self-funded add-on programs are available for us to make it ACA compliant. Indemnity plans, health sharing ministry plans, high deductible health plans, and of course you can carve it out on a standalone basis. Yesterday, I began doing something that I've been wanting to do for some time, and that is get out and meet with clients on an individual basis and then work with some brokers on referrals. So yesterday, I called on a building maintenance company. They had Blue Shield. This building maintenance company had 350 employees. Those 350 employees are paying over an average of $500 for their plan, the medical plan. And the employer's paying about 2/3, and the members are paying, the employer's paying 2/3, and the members paying 1/3 of the cost. $500, that's a lot of money a month to somebody in the building maintenance side of the business. I took a MEC plan in there, one of our brokers that asked us to present it, and along with the prescription drug, and the MEC plan came out at $187 total, including our prescription drug card plan. Quite a savings, and this particular client's pretty excited. So we call it plug and play. It's available right now. We've been selling it for a number of years, and I think that we don't need 60 days to implement a plan. We don't need 45 days. We don't need 30. We can actually implement a plan the first of the month, all right, in almost every situation. So our enrollment dates are usually the 1st, the 15th of the following, or the 1st of the following. So there's plenty of opportunity for you to work with when you want to bring them on. And we actually have a way to turn someone on within 48 hours or less. Adrian? Well, I don't know if we're not going to go into the agent portal today, but it handles everything for you: agent appointments, members, individual members, group enrollment. You've got the drug lookup tool, the pharmacy locator. You can print and email member ID cards. You've got a self-enrollment link that you can send to members for them to sign up. And you can view your commission stats and historical enrollment data online anytime once you're part of this particular program. I think that's it. And I'm open to questions, Adrian. So anyone have questions? Yeah, we're not going to cover that, I think. So if you've got questions, I'd love to answer them. I'd love to have, help you if I can. The people that are doing this are doing pretty well. I mean, I have to say, very well, whether it's the individual market or the group market. And our biggest task is to make sure that we protect the financial integrity of your team, Insurance Advisory, so that you're getting the right kind of technical support that you need. Everything we do is done online, and so having said that, these testimonials are pretty good. So
thank you, Dave. We appreciate it. That was great. There is a question on the chat from Matthew asking how much the plan is for the monthly individual. For our individual rates for the generic only plan start at $44.81, and for the brand wrap plans it goes from $55.89 to $61.03. When you are an appointed agent with Pram, you can go onto your portal and you can pull down the plan designs and rates sheet and have that available with your clients at all times. So that will be easily accessible for you. Great question. Thank you. Is there any other questions that you have?
I saw a plan the other day that a brand, and generic plan with Blue Cross, and that plan was $89 a month for an individual. So we're less than half in just about all the situations that we see. I'd love to have you ask
Dave,
questions.
Maybe there's another question that popped up on the chat. Can it be combined with ACA plans?
Yes, it can. What we do with the ACA plan is we add that as a self-funded benefit, like under the MEC. So the administrator for the program is, let's say they've got a MEC plan in there, and they put our plan in, and then we add those extra benefits to make it ACA compliant. And there's two separate bills, and it works pretty good. And the one case we've got going several thousand lives, so it seems to be working beautifully so far. We haven't had a single complaint yet, and I hope we don't. And by the way, I want to talk about that for just a second. We've been in business, as I said, for 30 years. We've been doing this particular program for about 16 years, and we have only had 2 complaints ever, and they were resolved. The first complaint was when we did the Nevada Senior RX program, and it was for seniors only. And this gal, I'll call her Hilda, she went to the pharmacy, and there was a rent-a-pharmacist in there who was unfamiliar with processing prescription claims, and he charged her the full amount, not a copay, but the full amount of the drugs, $278 worth of drugs. And I found out about it late in the afternoon. I got on a plane the next morning, flew up to Governor Gwynn's office in Nevada, and gave Governor Gwynn a check for that $278, and the matter was resolved in 24 hours. So we care. I mean, we really do. And if there's something we can do to help you, we would, we'll be there. You can count on us.
Well, Dave and go ahead, Adrian. Take care of the questions.
Oh, yeah. Matthew had asked another question about what the website is for this plan, and I just wanted to give you the Pram website, which is pram.com. But as far as being able to pull off any of the benefits or the marketing sheets or seeing the rates and whatnot, you would have to be an appointed agent through Pram, and we can talk about that later. Or you can get with Dan, and Dan will help you set you up, and we'll be happy to help facilitate that on this end.
Yeah, Adrian, we definitely would love to help these agents get appointed. And I did want to say that if you're presently working in the under 65 health market, whether it be marketplace or off marketplace plans, or some of the alternatives that are out there that we're finding great traction with some of these hospital indemnity products. If you're not into those, let us know. We can show you how you can save people tons of money on premium and give them access to their benefits right away. And this product, this Pram product, is a great add-on to it. Or it's even a good get your foot in the door type of product, like Dave Wilson was telling us. You can keep working in the individual space if that's what you're doing, but really, what you probably ought to be considering doing is going after the small groups, the small employer groups, under 50 employees, who aren't required by the ACA to offer benefits. Those are the types of employers we're trying to help with these benefit plans that give the employees access to benefits without having to pay huge deductibles first. To me, it's a quality of life issue, helping people get the care that they need at affordable rates. And so I just wanted to chime that in. We're getting more questions coming in. This is great. Great questions, everybody. I'll let you handle this one, Adrienne. Can you do this with a short-term plan?
Yes, thank you for that. Can we do this with a short-term plan? Well, our plan is month to month, so the members build once a month for their plan. So yes.
I'll throw a question out there to you guys. In my time of being appointed with the product, which, by the way, the agent portal is so user-friendly, you guys. It's amazing, the tools that they have there. You can actually email, the product information with a self-enrollment link to your prospects. And it's very user-friendly for them as well. But the question I do have is, as I've been looking up certain drugs on the formulary and on the drug lookup tool, I have came across some drugs that aren't in the formulary. So can you kind of explain a little bit, though, that there is still a discount, even if it's not on the formulary?
Yes. So that's a really great question. And really quick before we go, Matt had also asked, just going back to the other questions he had asked, is can you pay for it annually? No, we do not have an annual payment process. The member is billed monthly and can cancel their plan at any time. Usually when the I do want to mention this to all the agents, because whenever a member reaches out to us to cancel their plan, we always usually reach out to the agent to let them know that the member's contacted us directly, just in case the agent would like to go back to their member and try and resolve whatever they're feeling about canceling the plan. So I just want to throw that out there. Is there any discount if you pay for it annually? Again, there's no annual payment, so that would kind of be a moot point. Going back to the drug lookup that Dan had asked, we do have a network contracted rate even for drugs that are non-formulary. So that could be as little as 5%, and then as large as I've seen it up to like 85% or 90%. So it just really depends on the drug. A lot of these newer drugs that are coming out that do not have generic components to them usually tend, if they've been out they're newer within the last 5 years or so that have come out, we do not cover them because of their usual high expense. But what I can tell you is that there's usually manufacturer coupons out there that the manufacturers themselves will put out, such as Xarelto. You can go to Xarelto.com and download a manufacturer's copay card, and that can be paired with our Pram fully insured card, because we are a commercially available insurance, and all copay cards require a commercial insurance program in order to be able to use it coexistently. So I'd always mention to the agents, I handhold a lot of agents through this process, I do help them with the setup at the pharmacy if their members having issues with that. One thing I do like to point out to agents is please do read the fine print in terms of use on the copay cards, because some of these ones have maximum benefit per year. So you do want to keep that in mind as well when you're not just pitching it that, it's going to always be covered under that particular copay. But I'd be happy to walk through any of that with any of your clients if you ever had questions on that. And again, in order to use the manufacturer coupon, the client or the member would have to be on a brand wrap plan. The generic only does not count. Another question on the chat was, go ahead, sorry.
No, I just wanted to mention that if you look at our generic only program, we took the top 250 brand name drugs, and they have a generic equivalent available on 94% of them. So only 6% of the top 250 brand name drugs do we need a brand. So that's rolled into that brand wrap 1 and 2. So it's a tremendous program for generic utilization, and that's pretty exciting. When you talk about the member is, if the member uses our program at the pharmacy and the drug is not covered for some particular reason, they'll still get our discount. It's purchased through the plan. If they were to leave and not come back and try to purchase it that way, then they would have to, they may not get a discount. It's purchased through our plan. They're going to get our discount. Again, we don't add a nickel to the cost of that drug. So go ahead, Adrienne.
The other question on the group chat was, what are the group rates? And the group rates are the same as the plan rates and designs for this plan because it is a plug-and-play plan. So, but we're happy to discuss with you if you had a very large, like several thousand group. But other than that, usually typically in the individual market, we don't typically see agents that have that. But if you are, please bring us to Prospect and we'll discuss.
Yeah. There is we experience rate large group, and large group generally is 500 lives or more, and so the rates that you are seeing, they may not be that high at all if it's experience rated. So if their experience is good, that's wonderful. If it's bad, it could be higher. So.
Yes, there's another question on the chat. How do we get appointed? Oh, yeah, Dan looks like he just answered you on that. Dan can connect with either myself or Diana, and what we would do is we would send out a personal link to any agent that was interested on getting appointed, and that link would come straight to your email box, and it would take you about less than 10 minutes to fill it out. It's a 6-step process, and it includes a background check on you as well to get you appointed with Pram to market our product. So we can also go over that more in detail if and when you guys are ready to move forward.
And just to comment also on that, the appointment, the contracting, like Adrienne said, it takes you about 10 minutes at the most, and very user-friendly on the website, actually online. And actually, I think it only took like 2 days for me to get my writing number once I completed everything. So it's a pretty quick process. That's faster than most carriers, if you guys know. So, yeah, absolutely. Well, just really great discussion going on here today. And if there's any final questions, get those typed into the chat box here before we wrap up for the day. Any closing comments then, Dave or Adrienne?
Well, I would like to say,
go ahead.
Yeah, I would like to say to all of you that we give a damn. You're our lifeblood. We didn't last 30 years without having some wonderful people like yourselves supporting us and with clients that have a need for our product. So if there's anything we can do to help you in the group market or the individual market, please let us know, and we will endeavor to resolve that quickly for you.
Well, thank you, Dave. Appreciate you being with us today. We're honored to have you. You're a great person in our industry, and we appreciate everything you've done over the years.
Thank you. Appreciate that.
Thank you so very much for having us on today.
Okay, folks.
Absolutely, and I'll be following up with everyone. As soon as we get offline here, and be watching for my phone call or email. Thanks everybody for joining us today. Again, Insurance Advisors Direct. We feel we're a full service field marketing organization. We're here to help you, all you agents, grow your businesses, and I think this Pram is a great tool to help you do that. So again, thanks for joining us, and I think we better wrap it up here. We've already used up several minutes of everyone's busy day. So feel free to reach out to me for questions. Toll-free phone number 800-381-0977, extension 106. Dan Greer with Insurance Advisors Direct. And we thank you. There you go. There's my information. So again, thanks to Adrienne, Diana, and Dave for joining us today from Pram. And we look forward to working with all you agents. Thank you.
Thank you.
Have a wonderful day.